Good evening, folks. Today it is the 24th of June, and today I've been for another CBT appointment. It's been 2 weeks since I had my last appointment, and we knew that that was going to be the case. We agreed a 2-week appointment, and I was given some homework, and the homework was to use the syringe that had been given, and I had to touch my skin with it and kind of rate my levels of anxiety before I did the exercise and during the exercise, and finally at the end of the exercise, to see if I could see a clear evidence that my levels of anxiety were coming down the more I was exposed to looking at that syringe on each of the occasions that I did it. So I had this kind of thing to fill in, an exposure exercise chart, and you can see on the bottom there it's it asks different levels of anxiety, so I had a bit of a guide as to what to use. So today I've been back and we have looked at what else I can now do to try and ultimately meet the aim of being able to have an injection or a blood test or even a visit to the dentist without having those extreme levels of anxiety. So we referred back to something that I was asked to complete on the very first week, which is the things that I avoid that make me anxious. And some of that were things like not liking to walk on slippery ground, being worried about trips, slips and falls, because all of those things could potentially lead to injury, and when you have an injury you have to go to hospital. So today we looked at, so now I can touch the needle to my skin and I've no anxiety about that whatsoever. So what can we do next? And obviously we can't kind of put me into a situation where I'm at a risk of slip, trip or falls, because that'd just be silly. So we decided that what we would do for the next week or so was actually watch videos of people having syringes put into the skin. So we looked at videos, training videos actually, of people being taught how to vaccinate, and yeah, that straight away, when I was asked to watch the videos, I was extremely tense. I can't say anxious, but really, really tense about it. And I actually started looking at the first videos, and when I knew the needle was about to go in the skin, I was kind of, no, I can't look at it. But obviously, I knew that I had to force myself to look at the videos, because the exposure, the more you see it, the less anxious you become about things, is the way forward. So we spent about 15, maybe 20 minutes looking at a variety of videos. And I honestly have to say, at the end of the 20 minutes, I could actually look at somebody having a vaccination, and also at somebody else having a blood test, when blood test is actually one of the things that makes me even more anxious than thinking about a vaccine. So guess what? My homework for the next week is to find some videos on YouTube and spend about 10 minutes every day having a look at videos of people having vaccines, having blood tests, etc. And we'll look at how that brings my level of anxiety down over the next week. And I'm also looking at sourcing one of those little pens that diabetics use to prick the finger to do a blood test, because at some point we're going to have to introduce a needle. And I remember last time that is the thing that we used. So the clinical psychologist who I used to see back in the 1990s, he actually sourced one of these diabetic blood test lancet things, whatever they're called, and I had to start sort of pricking my finger a couple of times a day to help me get used to the pain, or what I perceive as pain, when that is being done. So today actually was a pretty good day, and I've got an appointment next week, but it will only be on Teams. I won't actually be seeing my therapist face to face because I'm away working in London. So we're just going to have to do a Teams talk, and we'll see how I go on in the next week. So all's looking good, everything's looking positive, and thank you once again for listening, and I hope some of you found that helpful.